Hello and welcome, everybody. Happy Thursday. This is Nurse Eunice with Florida Train Academy. And in today's CNA and PCT practice review, we're going to be covering caring for an abusive patient. So we're going to get started in about 10 seconds. I want to give everyone time to receive their notifications and we'll get started shortly. Welcome, everybody, and hello. All right, I hope you all are having a great day and let us begin. So, question let me actually read the background. So, Mr. James Wilson is a 25-year-old male. He was admitted to the hospital after being found disoriented and aggressive in a public setting. There are suspicions that he may be under the influence of illegal drugs. Mr. Wilson is physically and verbally abusive towards staff, making it more challenging to provide care. When he arrives to your hospital, he is agitated, pacing the room, and he is verbally threatening the staff. He refuses to cooperate with assessments and attempts to leave the hospital against medical advice or AMA, meaning that a doctor hasn't cleared him to be discharged. Security has been called to ensure the safety of staff and other patients. And here we go. Question number one. As a nursing assistant, what is the most appropriate initial action to take when you first encounter Mr. Wilson? A, attempt to calm Mr. Wilson down using soothing words. B, restrict Mr. Wilson's movement to prevent him from leaving. C, ensure your own safety and call for additional support. Or D, confront Mr. Wilson about his behavior and demand compliance. And if this is your first time here, feel free to put your responses in the comment area. We're going to have fun. We're going to take care of Mr. Wilson, and we're going to have a good day on our shift. So I see a lot of A's, and I finally see a C. So Millie, yes, you all. I need for you to protect yourself. Ensuring your safety is the most important priority. So the answer is C, ensure your own safety and call for additional support. Safety is paramount when dealing with a verbally and physically aggressive patient. Calling for help ensures there are enough staff members present to manage the situation. So I know we focus a lot on communication, and you can talk smoothly as you're backing up, getting out the door, because I don't want you getting hurt. So do not remain in the room. Get out of the room, get out of harm's way if a person is being physically violent towards you. Question number two. What is an essential aspect of managing a patient suspected of drug use and exhibiting aggressive behavior? A, administering sedative medication to calm the patient. B, applying physical restraints to prevent movement. C, implementing de-escalation techniques to calm the patient. Or D, ignoring the patient until they can calm down on their own. Yes, everybody. Yes, it is C, de-escalation techniques. Oh, yes, the stories I could tell you. So, I had a patient who picked up a chair and threw it into the wall. He could have thrown it towards the other patients. So I didn't act out. I wasn't too stressed. I said, "What do you need right now?" And he threw the chair against the wall because he was ready for a smoke break. So if I would have acted out and become aggressive with him, I could have made that situation so much worse. So you want to de escalate, you want to talk calmly, figure out what the problem is, and then call for help if you cannot de escalate the situation. So you are correct in de escalating. So, implementing de-escalation techniques to calm the patient. It involves using non-confrontational approaches to diffuse the situation and promote cooperation without resorting to physical intervention. The last thing you want to have to do is to go hands-on with any patient. So let's continue. We're still taking care of Mr. Wilson. So, situation update. With the assistance of security and additional staff, Mr. Wilson is temporarily calmer. He remains guarded and uncooperative with his assessments. Question number 3. What approach should be used when communicating with Mr. Wilson to promote cooperation? Speak loudly and assertively to assert authority. B. Use clear, calm, and respectful communication. C. Limit communication to essential instructions only. Or D. Avoid eye contact to prevent further agitation. Let's communicate with someone who has been verbally and physically aggressive. What would be the best choice? And you are absolutely correct, everybody. It is B. And so the reason why I chose this photo, because when you all first start off in the nursing field, you're so meek and so mild, and you let everyone run over you initially. And then you finally find your voice so you can be calm, clear, and respectful without letting people push your buttons. And so this picture of a fresh CNA, she is able to tell this patient, I'm going to leave the room because I see that you are become upset when I'm present. Let me go get help or assistance, or your nurse. Don't use words like calm down, because when you say calm down, that actually irritates them and makes them act out more. And so when you use calm, clear, and respectful communication, it helps to establish rapport and reduces the likelihood of escalating the patient's agitation. Question number 4. What safety measures should be prioritized when caring for Mr. Wilson? A. Leaving the room door open to maintain visibility. B. Restricting access to bathroom facilities. C. Administering medications to sedate the patient. Or D. Using physical restraints during interactions. Right now, he hasn't hit anybody. What is the best response? Yes, Anna. Yes, Karen. Let's see who else. Deborah, Rose, Jessica, I'm blessed. Kamala, you all are correct. Leave the door open. That way, everybody who's walking by, especially the hospital staff, we can see and or hear what Mr. Wilson is doing. So leaving the door open to maintain visibility is the correct response. And the rationale is that the safety measure leaving the room door open allows the staff to monitor Mr. Wilson while respecting his privacy and maintaining safety for both him and the healthcare team. If we leave that door closed, we walk in, we don't know what's behind that door. So leave the door open. Question number 5. We knew that he was, going to become aggressive again. The patient becomes verbally and physically aggressive, hitting a nurse. What should be the nursing assistant's first action? A. Call for help. B. Apply restraints immediately. C. Leave the patient alone to calm down. D. Give the patient medication. Oh, I can't trick any of you all. Great job. Yes, I need for you to call for help. You're going to scream help. Press that panic button. And you and that nurse need to be getting out of the room. So safety is the top priority. Calling for help ensures that additional support is available to manage the situation safely. And now that we have help and we execute the plan would be for you to get one arm, you to get one arm, you to get one leg, and you get the other leg. It may be 5 of us in there. We're going to have to restrain this person. So question number 6. Once the patient is restrained, what is the most important factor to monitor? A, the patient's comfort level, B, the patient's vital signs, C, the security of the restraints, or D, the patient's skin integrity. Trying to get you to think in the role of someone who works in a hospital setting. CNAs can work anywhere where there's a nurse, so you can work in mental health also. Once you restrain someone, and I have not seen the correct response yet, once you restrain someone, yes, Merlene, you increase their chances of death and disability. Because as soon as you restrain them, what is their goal? Their goal is to get unrestrained. Their goal is to get up. And so sometimes they can start moving about, they can injure themselves, or because we think that he had drugs in his system, he could stop breathing. So, you all, I need for you to monitor the vital signs of your restrained patients. That is the priority. We can take care of skin and comfort once we get them back breathing again. So, you want to do for behavioral restraints. I can't tell you the answer because it's on one, that's another question, but just think you want to monitor them quite frequently. So monitoring a patient's vital signs after restraining them is crucial to detect any physiological stress, ensuring their safety and well-being, and identify any medical complications early. So on this monitor, for right now, everything's normal. Heart rate 60, O2 saturation is 98%, blood pressure is 120/80. Looks like his respiratory rate is 12. And so you want to keep monitoring to make sure that nothing changes. Question number 7. Who is responsible for giving the order to apply restraints to a patient? Is it the nursing assistant, the patient's family member, the physician, or the charge nurse? Let's see. You know how much I enjoy getting on here, spending time with you all. Sorry for being late today. I had to finish up at the office and then find time to get online. So, who gives the actual order? Yes, you all are correct. It is C. The physician gives the order. So the nurse calls and like, hey, doc, this patient's beating me up. I need an order for a restraint. I need an order for Ativan, for Haldol. So the physician gives the order and then we implement the order. So restraints can only be applied with a physician's order to ensure proper medical oversight and adherence to legal and ethical guidelines, because restraints should be like something we do last. There's so much stuff that we can do before we have to restrain somebody. So we just don't go and allow nurses and CNAs to choose who should be restrained, because sometimes we'll restrain people when all they needed was a sitter or another less invasive or less restrictive type of device. Question number 7. How often should a restrained patient circulation be checked when applied for behavioral reasons? Is it every hour, every 2 hours, every 15 minutes, or every shift? So that means that this patient is still in their acute phase. They are not calm. They are fighting in the bed, even though they are restrained. How often do you want to be checking on your patient and checking those restraints? Magina, Fatina, Anna, Karen, Cleo, Rose, Deborah. Awesome caregivers. Every 15 minutes for behavioral restraints. You go in there, you just set your blood pressure cuff, your equipment to recycle every 15 minutes, but then you need to physically go in and check. And then as a reminder for restraints, some facilities will have a 1-finger rule, where as long as you can put 1 finger between the restraint and the patient's skin, that leaves enough room for circulation. Some facilities are going to have a 2-finger rule. Go by your facility's policies, and don't forget that a restraint should never be attached to the actual side rail. It is attached to the frame that the mattress sits on. Question number 8. What is the purpose of using restraints on a patient? Is it A, to punish the patient, B, to control the patient's behavior, C, to prevent the patient from harming themselves or others, or D, to prevent falls? Yes, perfect. Everyone knows the answer. The answer is C. We're going to apply restraint so that the person does not harm themselves or others. Restraints are not used as a form of punishment, and restraints do not prevent falls. Good caregivers prevent falls because, as I stated before, when you tie someone down, their goal is to get up. So a restraint doesn't prevent a fall. It's more than likely, if you're not checking on them, they're just going to slide out the restraints and end up injuring themselves. Question number 8, we're still taking care of Mr. Wilson. What should a nursing assistant do if they notice a change in the patient's behavior or condition while restrained? A, adjust the restraints. B, document the change and continue monitoring. C, notify the nurse immediately. Or D, ignore it if the change is minor. So Mr. Wilson is now restrained and his respiration rate went from 12 to 6. What do you want to do? Yes, everybody. First C and then D. Make sure you document that you told the nurse. So yes, you're going to notify that nurse immediately because any change in a patient's behavior or condition should be promptly reported to the nurse to ensure appropriate medical intervention. Remember, we all work together to save these patients' lives. Oh, I do have a funny story to tell. So working on the psych unit, I promise you, about the same time every day, this guy would try to beat me up. And at the same time, every day, he would also apologize for trying to beat me up. He never succeeded, but craziest thing ever. I'd be like, hey, don't you remember you're trying to beat me up 5 minutes ago? Question number 9. What is a key consideration when selecting the type of restraint to use on a patient? A, the color of the restraint. B, the restraint's ability to prevent movement. C, the least restrictive option that will effectively ensure safety. Or D, the ease of application. Yes, the least restrictive. So we can do 2-point, which would be like the upper extremities. We can do 4-point, which would be the upper and the lower extremities. If you put 3 side rails up without a doctor's order, that could be considered a restraint. So if your patient doesn't have an order for all side rails up due to safety, and you put them up to keep them in their bed, well, you've restrained them without a doctor's order. So we always want to use the least restrictive option first. So maybe instead of putting wrist restraints on, your nurse can get an order to raise all the side rails on the bed or to get a sitter. So C was the correct response. Oh, wow. We've had a rough shift. Mr. Wilson has worked us, and we only had 10 patients, but he took most of our time. So now we get to plan for his discharge. So Mr. Wilson's behavior remains unpredictable. So sometimes he's really nice to you, and the next moment he wants to be aggressive again. The healthcare team is considering a referral to a psychiatric unit for further evaluation and management. What is an important consideration for Mr. Wilson's discharge planning? A, allowing him to leave the hospital whenever he wishes. B, ensuring he understands the consequences of his behavior. C, discharging him without follow-up care due to his behavior. Or D, releasing him to family members without further intervention. Remember, he was brought in because of disorderly contact. He has physically abused a nurse. What do you think the best response should be? Yes, everybody. Yes. And so, unfortunately, the healthcare field, nurses, CNAs, doctors, we get unfortunately abused by these patients. And every now and then, we do have security, but it's rare that a nurse actually calls the police on a patient. So, these patients can sometimes be abusive towards us and they don't have just consequences. And so, you want to make sure that, especially your nurse, whenever she's discharging him, they're going to talk about those behaviors, because if he doesn't change those behaviors, this time he's in a hospital in a psych unit, but the next time he could be really injured, or he could be institutionalized, put into a facility long term, or end up in jail. So the nurse and the case manager will work with him so that he understands the consequences of his actions. And as I stated before, the answer for that one was letter B. Question number 11. What should be included in Mr. Wilson's referral to the psychiatric unit? You all, he's finally getting out of here. A, Mr. Wilson requires immediate medication management. B, please admit Mr. Wilson as soon as possible. C, evaluate Mr. Wilson for substance use and mental health concerns. D, discharge Mr. Wilson back to the community. What do you think the best response would be when the nurse is giving report to the psychiatric unit? Yes, you all see, because he could still have drug seeking tendencies. He could be sneaking things into the unit, his family members or friends could. And so that is why when you check a person's belongings, especially if they have a mental health disorder, you're supposed to be checking those belongings to make sure they don't have anything sharp that could injure you, that could injure themselves. And if so, you're locking all of that up. And so you want, and it could also, they could have some illegal drugs or some paraphernalia with them. So yes, we need to evaluate him for substance use. And if you're the CNA on the mental health unit who's doing intake, you have to check everything, all their body cavities too. We're checking it all just to make sure they're not bringing things into our facility. So once he receives help, if it's just alcohol, he can go to Alcoholics Anonymous. They have Narcotics Anonymous. There are so many resources that the nurse and the case manager at the hospital can work with the patient so they can receive help, so they can receive rehab and hopefully recover. And guess what, team? We did it. We took care of our first patient who beat up a nurse. It's not funny, but we have to laugh about stuff because in the healthcare field, we see some of everything. And tomorrow I will come back with another one of the new type of questions I'm giving you. I just want to keep giving you questions. I want to humanize the questions because you're not just taking a test. You are preparing to be out in the real world with patients who have feelings, emotions, and fists. And I need for you to be able to protect yourself. So this is Nurse Eunice. You all, thank you all for joining. And yes, Anna, I know I wasn't supposed to laugh. Someone's going to comment, that wasn't funny, you shouldn't laugh. But I appreciate you all. I love you all. And I know some of you all had your test this week. I hope that you passed your CNA exams. And I will see you in the next video. Bye, everybody. You have a wonderful day also.